Blood and lymphoid tissue pathology. Diagnostic Insights delves into the intricate histopathological and molecular landscape of hematologic disorders, encompassing leukemias, lymphomas, myelodysplastic syndromes, and reactive conditions. It emphasizes diagnostic differentials, immunophenotypic profiling, cytogenetic aberrations, and emerging biomarkers, elucidating their clinical implications for precision medicine, prognostic stratification, and therapeutic decision-making in hematopathology. Hematopoietic cell development occurs in the bone marrow, where hematopoietic stem cells, HSCs, differentiate into all blood cell types. This process, called hematopoiesis, produces myeloid, RBCs, platelets, monocytes, neutrophils, eosinophils, basophils, and lymphoid, T cells, B cells, NK cells, lineages. HSCs reside in specialized bone marrow niches regulated by cytokines and growth factors. Once matured, cells enter circulation and migrate to tissues to perform immune, oxygen transport, and clotting functions. Malignant disorders. Leukemias and lymphomas classification provides a comprehensive framework for stratifying hematologic malignancies through an integrative approach encompassing morphologic evaluation, immunophenotypic profiling, cytogenetic and molecular aberrations, and clinical paradigms. It underscores the evolving classification systems, facilitating precision diagnostics, risk stratification, and targeted therapeutic interventions in hemato-oncology. Immunohistochemical and molecular diagnostic techniques. Immunohistochemical, IHC, and molecular diagnostic techniques are essential for disease diagnosis, particularly in oncology, infectious diseases, and genetic disorders. Immunohistochemical, IHC, techniques. IHC detects specific antigens in tissue sections using antibodies. Key steps include tissue fixation, antigen retrieval, antibody binding, and visualization using chromogens. Applications. Cancer diagnosis. Identifies tumor markers, e.g., HER2 and breast cancer. Infectious diseases. Detects viral/bacterial antigens. Neuropathology. Assesses neuronal markers like GFAP. Under 2. Molecular diagnostic techniques. Molecular diagnostics analyze DNA, RNA, or proteins for mutations, infections, or genetic disorders. Common techniques. PCR and RT-PCR amplifies DNA/RNA for pathogen and mutation detection. FISH identifies chromosomal abnormalities, e.g., HER2 amplification. NGS sequences multiple genes for precision medicine. Western blotting detects specific proteins, e.g., HIV markers. Applications. Oncology detects cancer mutations, e.g., EGFR and lung cancer. Infectious diseases identifies viruses, e.g., COVID-19, HIV. Genetic testing screens hereditary conditions, e.g., BRCA1/2. Common benign and reactive hematologic conditions. These are non-cancerous blood disorders caused by infections, inflammation, or physiological changes, often resolving with treatment of the underlying cause. Reactive leukocytosis. Increased WBCs due to infections, stress, or inflammation, e.g., neutrophilia in bacterial infections, lymphocytosis in viral infections. Anemia of chronic disease. ACD-reduced RBC production linked to chronic infections or autoimmune diseases. Iron deficiency anemia. IDA low hemoglobin due to insufficient iron, e.g., poor diet, chronic blood loss. Reactive thrombocytosis. Elevated platelet count from inflammation, surgery, or iron deficiency. Lymphadenopathy. Enlarged lymph nodes from infections or immune activation. Hemolysis. Premature RBC destruction due to infections or autoimmune conditions. These conditions are typically manageable by treating the underlying cause and monitoring blood parameters. Emerging trends and future of diagnostic hematopathology. Diagnostic hematopathology is evolving with advancements in molecular diagnostics, artificial intelligence, AI, and personalized medicine. Key trends include molecular and genomic testing. next-generation sequencing, NGS, and minimal residual disease, MRD, detection enhanced precision. AI and digital pathology, machine learning aids in automated diagnosis and pattern recognition. Multiparametric flow cytometry improves sensitivity in detecting hematologic malignancies. Targeted therapies and biomarkers. Advances in immunophenotyping guide personalized treatment. Automation and standardization. Enhances diagnostic accuracy and workflow efficiency. The future of hematopathology will focus on integrating AI, big data, and precision medicine for more accurate, efficient, and individualized diagnoses. This lecture is prepared and presented by Ghulam Farooq, a renowned AI technologist, educator, and YouTuber. The content of this lecture is based on standard pathology textbooks, such as Robbins' Pathologic Basis of Disease, Rosai and Ackerman's Surgical Pathology, and Muir's Textbook of Pathology. If you find this video helpful, please like, share, and subscribe, and don't forget to hit the bell icon for the latest updates on pathology. You can also comment below to request a free PPT file of this lecture. Your feedback is valuable to us, so please take a moment to share your thoughts in the comments.